Dr. Mother Kandula with Advent, your host for Adventing. We talk about everything ENT related and not ENT related sometimes too with Dr. Ethan Handler. How you doing?
I'm doing well. It's Monday. Happy to be live.
We always do sport. We do these icebreakers and it always happens to be sports and it always happens to be under COVID tyranny, which
Yes.
we're in right now. Sports.
It's nice to have sports back. It's nice to have Bucks back.
Yeah.
You know, watching them. Well, they're 1-1.
So they won one, lost one.
Yeah.
In the bubble.
Yeah. But,
Sorry.
you know, they're looking good. They're going to fine tune. They're going to be in the playoffs, obviously. It's nice to see, George Hill didn't have too good of a game yesterday. He was pretty instrumental kind of during the season and was playing pretty well, but Bledsoe's still out. I mean, it'll be nice to get all the team back, but fortunately we don't have to see the Rockets unless they probably make the championships.
Yeah.
So let somebody else deal with them.
Yeah. It's interesting. They got the virtual fans. I didn't really
what do
pay
you think
attention
about
to them. I don't know.
I mean, I guess
it's cool. I guess it's better than nothing.
It's better than empty stands, right? Because
Sure.
it would seem really weird. But what I thought was funny in SportsCenter did this is like there was a blowout and the virtual fans left, which I thought was they could have made them like start to leave the stands.
That's appropriate.
Yeah,
I guess.
I was like, well, all right, I'm out of here. I might be a computer program, but screw it.
I wonder. So the fans are just watching the game on like a Zoom thing, probably.
No, are they real?
Yeah.
Oh, see, I just thought it was like computer generated.
No. It depends on which fans. In the NBA, those are real people. They're
being piped in, like
Yeah.
their emoji or something.
like no, they're there. They're like I don't sit there and watch them, but they've had like notable people.
Oh, so they actually left the game, but it was really people just turning it off.
I'm not sure how that works. I don't know if you can just leave because I think for the Bucks, it's the crew that's loud. That crew.
Yeah.
I think they're preferentially selected to be the Bucks talking heads or whatever.
Yeah.
Fan heads. So.
But I saw a guy like lift up a baby. So he must have been doing that in his house. I was
That's
like,
what I'm saying, yeah.
What are these people doing?
You got babies in your house. You
That's
got a
true.
baby, just lift it up.
You have babies
Put
in
it
the
on,
house.
put it on screen. So, but
Fascinating.
yeah, so it's better than sports are good to be back. There's definitely a massive in my life, the first void ever. Although I fill the void. I don't think I've said it here on Adventing before, but I filled the void by going back to 2010 and watching that Packers season all the way through, which is awesome. And now I'm in 2011, so I can't actually get to the real sports now until I finish the 2011 season, which I know how it ends, which it ends very poorly. But
You'll have to remind me because I wasn't in Wisconsin.
all I'll remind you of is that Jermichael Finley
yeah,
was awesome.
right.
If you want to
he had a terrible injury though.
he had a neck injury the year, but 2011 they had the phenomenal receiving core. He was at the center. He was a guy that would change the field. Actually, him and Nick Collins. Nick Collins went out in 2011, and I remember this vaguely, but like walking through the season when Nick Collins went out, it was early in that 2011 season. The Packers, their defense just fell apart. Until this day, and nobody really remembers Nick Collins, and not many people remember much of Jermichael Finley. But
I remember hearing about him just because I was in residency, but I mean he was around. I just remember hearing about him. But was he a game changer in the way that Gronk?
He wasn't as big as Gronk, but he was very talented.
Or Jimmy Graham in his heyday,
like a Jimmy Graham-esque. He was a great player, and then he just had an unfortunate injury, and then he was down. But off of sports, on to medicine.
Yes.
Which you know how to do a little bit of medicine.
Sometimes.
So the fundamentals. So if I stuck a piece of steak, I guess you could do the same thing, but I just shoved it into your trachea right now, and you went down.
Yeah.
And we called the paramedics, and the paramedics came. What do they need to follow? If you're rescuing somebody, what do you follow?
I mean, let's start with the first letter of the alphabet. It's A for airway.
Yeah. It's ABCs.
Yes, ABCs.
You don't get to B before you get A. Has to come before B.
Correct.
What's B?
B is breathing.
And C.
Circulation.
In that order.
Always in that.
Always in. A is the most important. B.
Yep.
C is teeny tiny. Although cardiologists and cardiothoracic surgeons they might view this differently.
Right.
We can all come in agreement the airway is super important.
Right. We're testing out some strategies here for my wife, who's a pediatric cardiologist, because I'm gonna use this on her later. So
you're the most important medical professional in that relationship.
Absolutely. 100%.
Because you deal with the A.
Right.
And she deals with the she does B and C,
right.
but mostly
Who
C.
really saves lives here? It's the A guy. not the C person.
Correct. B and C don't matter if you can't say. But on the airway front, so airway, people think of like your trachea, which is your windpipe, but your airway starts up top. It starts with your nose and your throat, which happen to be in our wheelhouse. That's all we do, our
Correct.
nose and throat issues. And so, when you think about it in that sequence, if basically, if your nose isn't working, you drop your mouth open, you can breathe through your mouth. Okay, fine. If your nose and mouth are not working, then if you can't get air between or in your nose and your mouth, then you're dead. Period. End of sentence kind of a thing. And so it's fundamental, although many people walk around with restricted airways. That's mostly all that we deal with are folks who are dealing with airway issues. They're not shut completely most of the time, but it's compromised, which has downstream effect. But the reality is, if your airway isn't working, then you can't breathe, obviously. If you can't bring oxygen in your system, your heart can pump for a little bit, but not for very long, and it's just going to stop. And so now you could have cardiac issues that are impactful and very, very common as well. But, all those things relate to each other. I guess the reason we bring it up, and the reason we're talking about this specific topic is I don't think people recognize the importance of the airway because we don't often talk about it. Everybody hears about, and knows about folks who have, heart attacks and strokes and circulation issues. You don't hear so much about the airway issues, although the airway issues, this is where it gets a little...
Well, it's because we take them for granted.
We take them for granted,
but assume it's working.
And but many people, they're not. And then a lot of folks that we treat have sleep apnea. Sleep apnea, by its definition, is an airway issue, but it creates breathing and circulation issues. And so that, to me, I'd say it's going in a little bit of a different direction, but on a chronic basis, if you compromise somebody's airway, it is going to impact the downstream issues, circulation specifically. And so for some, again, I don't think people think about it in this way, but for somebody who has sleep apnea, what we're doing is establishing an open airway for them when they're sleeping at night, so that they can live their fullest life in the moment, but they can take away some of these downstream effects from the B's and the C's with the breathing and the circulation. So that, if you want to sort of create a test kitchen for what happens when airways are compromised, you look at folks who have sleep apnea and the sleep apnea is not treated, and you look at the shortened lives and the compromised lives and the compromised days that happen from sleep apnea. But back to where we sit right now, I'd say, the ABCs, again, it's not part of it, we're saying it jokingly, but much of it I'm not. I'm dead serious where, airways, healthy airways are massively important for kids and adults. Correct?
Correct. 100%.
Yeah. And so I guess, and it's not like there's a debate about it, but I think that the challenge is that people don't say that with clarity enough. And because people don't say it with clarity enough, it doesn't ever get said. And the people who should be saying it are us. It should be us at Advent, certainly, but certainly other folks in the ENT space. A lot of the loudest voices I hear in this day and age are dentists who work in the airway as well. And I'm thankful for them. I mean, I'm thankful for that community to step up and say airways are important. And they really have kind of embrace that fact more so than our community. Our lowly, I said three lowlies, ENT community has not recognized the importance of our specialty, which is a shame.
No, I mean, I think from a dentist standpoint too, and especially as you and I have realized, dentists have had a challenge trying to find partners in this community that are kind of going to listen to them and actually partner with them to do something about it, because there's only so much they can do. And they can see all the downstream effects, especially from a crowding in the mouth and sleep apnea. But man, for dentists to try and get the ear of an ENT, it's a challenge.
Why is
it a challenge?
Here's the deal. So
I mean, it shouldn't be that way.
It shouldn't be that way, but ENT is the airway specialty, the upper airway. I mean, there are pulmonologists that deal with the lungs, but they have nothing to do with noses and throats and tracheas. And so for folks who, if you think about medical specialties, it's ENT. Whose domain is the airway? It's ENT. And so, but we have, for whatever reason, I don't know what that reason is, decided that when I say we, I mean my specialty, we don't really care about it. It's not even our, it's almost like we've ceded our concern for it for no reason I can understand. What are ENTs doing who are abdicating the airway space, and they're not doing their job, in my opinion?
Right. No, I mean, unless they're kind of, I guess, taking our, I mean, it's not just us, but hopefully there are some out there that are taking a very strong mindset to getting that open, the airway open. Because again, I also think that most people and patients don't really understand that, like, they may have COPD or asthma or some lung issue. And when this doesn't work, this ain't gonna work well, and so it's trying to connect the dots that seem so clear and logical, but even the medical community doesn't really kind of connect those dots. So like, okay, well, if you have a lung problem and a nose that doesn't work, get the nose working. It's only gonna help things downstream.
Yeah,
it's kind of this unified airway, kind of theory.
Yeah, I almost feel like I'm trying to get back into my ENT head is not in the normal ENT place anymore because because what we do is sort of deviated from the typical ENT practice, but the typical ENT practice who sees a nose that isn't working doesn't think, hey, I can fix that. They think, it's not that big a deal,
Right.
like deal with it.
Right.
When in fact, it's a huge deal, and if you don't fix that thing, I mean, I think so you take that patient you just described who's got COPD and a nose issue, I think a typical ENT practice would look at that patient and say, boy, that COPD issues, that's a big deal. Your nose is not that big a deal. We'll just
Exactly.
leave it alone.
Right.
Here's some Flonase.
Yep.
Like, good luck to you, buddy. And on the flip side, I'd say, we're not saying, and I'm not saying, and you're not saying, you fix somebody's nose and their COPD goes away, but I'd say if somebody has COPD or asthma or lung issues, and we're just using this for an example, they're compromised, if their nose is compromised, well, you're doubly compromised, and so if somebody's airway is compromised, why wouldn't you, and you could easily eliminate one area of compromise, why wouldn't you do that? And there's no reason why you shouldn't, other than you don't feel confident in your skill set to deliver a result, or you don't believe in it. One of the two has to be, or both, probably.
How many times in a textbook can you, whether it's Bailey's or Cummings, which are kind of the Bibles for ENT, did you ever see a statement that was like, the nose should work well day, night, period?
Yeah, I know. It doesn't happen.
I didn't really ever hear that until we started talking that way here at Advent, and and I was kind of on the other side of that too, and kind of dismissing some of those issues, like, honestly, because it's just the way I kind of thought about things. Hey, it's not that big a deal. It's your COPD is the bigger issue.
Yeah, and it's just wrong-headed thinking. I guess, like I said, it's wrong-headed, and so that's wrong. But on the flip side, we know with thousands of patients that we treat, when you get somebody's nose working, it's powerful. Powerful. And if they've got sleep apnea, if for whatever other issues they've got going on, basically both ways. If nobody's perfect, I don't think, are you perfect today? No. You're not perfect, I'm not
Some
perfect. So whatever other medical issues you have going on, if you combine that with a nose that's not working, you're going to accentuate the negative. If you get the nose working, doesn't make everything else go away magically, but sometimes we've seen folks, and it happens frequently, certainly for folks who have allergies and asthma issues, is you get the start of the airway working, and magically the downstream issues, they tend to, hover towards better. Not perfect, but better. And even if they're going to be horrific, and there are some folks that we treat who've got horrific other medical issues, and because we can do office-based treatments for them, we can get their nose working if that's what they need. Can't fix their horrendous other medical issues, but it's a massive quality of life boost to have a nose that's working.
Well, and we removed a barrier that people would use or doctors would use is, hey, your comorbidities, your other medical problems are too much of a risk for us to put you under general anesthesia.
Yeah, absolutely.
To do this, so hey, let's get these other things under control first, and then let's back into your nose. Whereas now it's kind of like, well, let's flip that on its head. Let's say, okay, great, stay awake. It's like going to the dentist. And I've been using that kind of thought process a little more with patients. Like, hey, you go to get a cavity, that's your experience, right? Sure. Like, that's what you should expect, and then you can get this thing taken care of.
Well, and I think that right there, honestly, is it's complicated, but the reality is the fact that we can get folks up and running and breathing properly without having to go to surgery and go to sleep allows us to make the statement, with the very simple statement that if your nose isn't working and you've got downstream issues, that you probably ought to get that nose, or at least you ought to have the option to get your nose taken care of. But when we say that, we typically mean in an office-based approach, and we could certainly do surgery if necessary, so it's not like we can't. But I think if all you could do is surgery on somebody's nose to get it working better, then you certainly aren't, I wouldn't, and I can't, and you can't operate on somebody who's really, really sick medically otherwise, because it's too dangerous. And so I think that's probably at the heart of why some of this thought got put into our heads. And unfortunately, most ENTs aren't able to offer the same services that we can offer as from an office-based approach. So if you were trained not to be able to think this way, and you can't offer the same options we can offer, then you just sort of revert back to kind of, I guess we just have to leave this thing alone kind of a thing. So I kind of get it. I mean, I don't get it. It's not. I'm not excusing anything, because it's not the reality of the world. The reality of the world today is that we can do simple things in the office that make massive changes to people's airways, and because we can do that in that more simplified manner, that more folks can take advantage of it, and that's a good thing. And so,
Yeah, I would question. This came up today because I was in the operating room this morning and just thinking through. We were using some, it was an implant kind of thing that releases steroid, but it was kind of like the idea that, like, why is something like that not covered in a surgery center, but it is in a hospital? And so I started thinking, like, I was just talking with some of the other staff there, but so I asked you this question: what percentage of sinus surgery or nose stuff that we do needs to be done in a hospital setting, even in ASC setting? To be honest with you.
Yeah, I mean, low. I guess the question, so I guess what percentage needs to be done not in an office? Let's kind of flip it, make it double negative, and it's pretty rare, and we can do pretty extensive work in the office. So I think for our, when do we have to go to the OR? Only when push comes to shove. So I think it's less than 5%, low single digits as far as, it's probably even lower than that when you say needs, because there are times where we're talking with patients about office options and OR options, and some folks will choose to do OR. Maybe it's a need, maybe it's just because, there's various reasons where somebody might choose that. But even there, I don't know if I would say it's because we couldn't do it in the office. It's more of a personal preference kind of a thing.
Let's say different. 10%, but then what percentage of that do you think should be done in a hospital setting?
Yeah, like none, really. Well, not none.
Small. Almost none.
Because I think when it comes down to it, if somebody is sick enough that they have to have their ENT surgery done in a hospital, which should be the barometer. That the barometer for having an ENT surgery in a hospital is because you need the hospital. And the only reason you need a hospital is because if you're sickly other than an ENT kind of sickly.
Correct.
And the reality, though, is 99.99% of all ENT procedures are done in a hospital setting, which ain't right. No. So, basically, to recap, 99.9% of ENT procedures don't need a hospital OR, yet 99.9% of hospital procedures happen in an OR. Yeah, so it's really messed up. It just is. But but I think that the challenge is, I guess, it's problematic for a couple of different reasons. One is cost. The second is that it raises the bar for folks to want to get something done, and it raises the bar, meaning decreasing and diminishing the ability of folks to seek out treatment or surgeons to offer treatment, because, gosh, is your nose blockage problem really so problematic that I have to take you to this hospital to get you to sleep to do this? And that's a pretty high bar.
Well, and it diminishes it in the patient's mind about how important it really could be or should be, because most people struggle with this issue. Wow, I have to do all this just to get this addressed, and maybe this isn't that big a deal and I should just live with it. Whereas the reality is, shouldn't live with it. It's not the way you should live. We can take care of it, right?
Right, which is profound. It really is profound. I mean, back to this airway thing and back to this, like, ABCs that we were talking about before. Airway is fundamental, and if your airway is compromised,
B and C don't matter.
No, and so and though the challenges of, before we were able to do some of these office-based procedures, the bar towards getting something done to get something corrected was too high.
Right.
In most places, even today, it still is, unfortunately, which is kind of it's too bad. But back to the truth, though, the heart works for the nose, right?
I mean, essentially, yes.
So when you go home today, you need to be able to you need to be pounding the table with that message.
Heart could be in the C-suite, but the nose is the CEO.
Exactly.
There's no question. It's important. It's upper level management. But
we don't have a problem with the heart.
Right.
We fully. But
it's a big muscle.
Yes.
And muscle wants to work aerobically.
Correct.
Not anaerobically. Yes. And the only way to provide that is airway.
Airway. Through the intelligent, functioning nose.
Yes.
Correct?
Yes.
So, all right.
100%. Yes.
Noses are profound.
Noses are profound.
Yeah.
Yes.
Yeah. We are. It's good. It's good. All right. Well, I think our time is getting short here.
Yes.
I think that today, I'm not sure when you guys are listening or watching this segment, but today we're opening a new office. Where is that at?
Oak Park.
Good answer. Yeah, that's true. Oak Park is where? What state?
I believe the great state of Illinois.
Great. Yeah, I don't know what's their motto. Illinois.
Don't know. I have no idea.
I don't know either. Illinois.
We have Chicago. I don't know.
Illinois. What's Wisconsin's motto?
It's a huge state. What is Wisconsin? Like we're Badgers? I don't know.
No, we're the.
I'm not from here. I don't even know what California's motto is. The 49ers.
I'm just trying to think of what Illinois is. So I mean,
what's the state flower in Illinois or Wisconsin?
I don't know about that. We're the Dairyland. Wisconsin. Okay. Wisconsin. If I say America's Dairyland would be Wisconsin's motto.
Okay.
What is Illinois' motto? I don't know. We have Chicago.
We have Chicago. Yes.
We have.
The.
I mean, it's a good state. I'm not knocking. I'm not. Yeah, it's not pejorative. The land of Lincoln. That's solid.
That sounded familiar to me.
That's
I was
solid.
thinking that, but
that's solid.
Oh,
you were thinking it.
The land of Lincoln.
I like that. Although, yeah.
Who does Wisconsin have that is Lincoln to Illinois?
Well.
Don't say McCarthy.
No, we have a run of really good quarterbacks.
Okay.
So, between Rodgers and Favre,
I mean, is that better than California's run of quarterbacks with Montana?
No, I'm just saying, Abraham Lincoln is to American presidents as Aaron Rodgers and Brett Favre are to American quarterbacks.
Okay.
They'd be on the Mount Rushmore of. So I'd say it's probably a tie between Lincoln and Aaron Rodgers. Tie. maybe
hair.
Give the edge to Rodgers because I think he's got at least back in the day he had better legs, like he could run around a little better than Lincoln. I think.
I can see that. Yeah.
Yeah. Are you gonna say anything bad?
No,
about
no,
Lincoln?
no. I'm just thinking just listening a little bit more about the history. Like he was incredible time for him to do what he did and live in that time. But yeah.
This is Aaron Rodgers or Abraham?
Definitely Aaron Rodgers. Yeah. I mean, man, what he has to deal with on Twitter, I don't even know how he is.
It rises to the level of.
Did he break up with Danica? Did that happen?
Yes, it's over.
Oh, God, it's just so
she's from Illinois. Well, no, she's from Wisconsin too.
That's why. Oh,
but she's a Bears fan, so
there's
that.
That was never meant to be.
It was doomed from the start. But Oak Park, we jest. We love you, Oak Park, and we are. Do you know where Oak Park is?
It's outside of Chicago.
It's right there.
It's west, isn't it?
Just barely west of the loop. So
very good.
Yeah, we've got
some trendy restaurants when they open again. Finally, I'm sure.
I think they're open on the street at this point. But so basically, I'm trying to Vernon Hills. That's our first Illinois location. Northbrook, Oak Park, Financial District is coming.
Right.
So we got Chicago covered.
Pedal to the metal.
Yeah, we're rolling. So, but that's you got any shout outs?
No, I think that's a pretty good shout out right there. I mean, shout out. No, sports are back. I'm excited. PGA next week for all those golfers out there. I'm pretty excited about that. Actually.
And with that one, this segment, that's all we got. Nobody cares. Does anybody care about golf? I don't.
Everybody cares. It's going to be at Harding Park, which is an amazing course actually, and it's a beautiful course along the coast in San Francisco, kind of that area. So lots of big cypress trees and good track.
I'll take your word for it.
All right.
You'll have to tell me all about the details of that event. All right. So if you're watching us, give us a like, give us some comments. If you're listening to us, same thing. We will be back with more captivating content in the very near future. Next week, hopefully.
Thank you, everybody.
All right. Take care. Bye-bye.